So for this first test, we're going to be going through the obturator nerve neurodynamic test. So Josh, for this test, I'm going to test how well that nerve can be stretched and how well it can tolerate movement.
Okay.
So what you should expect is possibly some reproduction of symptoms, kind of that numbness, tingling, maybe some pain and stretching. But let me know if it gets too bad and we can back off. So to start off, I'm going to have you put your arms behind your back, and then I'm going to have you keep your head up but just slouch through your back. Good, even more. There you go. And then I'm going to have you go chin to chest here. And I'm going to block the head. And then I'm going to lift the leg up and I'm going to abduct it. And then you let me know if you feel any reproduction of symptoms here, okay? Still good?
Yep.
Good. Anything?
No.
Okay. And that's about as far as I can get there without any symptoms. And if there was, I'd ask him after I would lift the head up, any decrease in symptoms?
Yep.
Good. So if that was the case, then it would be the obturator nerve, but if it stayed the same, then it would be more just muscle stretch of the adductor muscle. And then that's the neurodynamic test for obturator nerve. So now in this video, we're going to be looking at the lumbar UPAs and lumbar transverse glides. So these two tests, the first one, the UPAs, is going to test the lumbar segmental UPA mobility and symptom response, and then transverse glides will test the lumbar transverse glide segmental mobility and symptom response. So in this test, I'm going to be applying pressure to the spine in a couple different ways, and while doing that, I'm going to be looking at the relationship between pain, range, and resistance, and then looking for any sort of symptom reproduction. So Josh, for this test, you might feel some discomfort because I'm going to be pushing somewhat hard on your back here to see if I can get any symptom response and testing the range. So that's what you should expect, but if you start to feel any reproduction of symptoms, let me know, and then we can back off and move on to the next test. How's that sound? Good. Okay, so for lumbar UPAs, what you would do is first find the segment that you're aiming to assess. So I'm going to start off with L5, so finding the PSIS and then coming medially and superior just slightly. There we go. Finding the spinous process and then just coming off to the side to the articular pillar. And then you're going to have the thumbs kind of together like this, like a little pointer. And then you're first going to press down till you find R1, going gentle. And then you're going to push past R1, kind of going a little harder, and then a little harder till you feel R2. And it's looking for any symptom response and then any sort of stiffness as well. And then you can go to the next segment up, L4, same thing, finding the spinous process, coming off to the ipsilateral side onto the articular pillar, and then first finding R1, and then pressing past, going a little further till you find R2. So that'd be for lumbar UPAs. And then next for lumbar transverse glides, what you would do is same sort of thing, finding the spinous process. So I'll go again with L5 here. So finding the PSIS, coming medially and then just slightly superior. But this time with the thumbs, you're gonna have one pressing and the other one kind of overlapping on top to add a little bit extra pressure and support it. So coming onto the spinous process, coming onto the ipsilateral side, and you want to get kind of level with them, and you're going to push transverse plane here, looking for that R1 again, and then pressing R2, and you want to be level with them because you don't want to be pushing down, you just want to be pushing across. And then assessing for any symptom reproduction, and then determining the relationship between pain, range, and resistance. And these tests are good for frontal and transverse plane movements. And that's it for passive accessory motion for lumbar spine. So for this video, we're going to be looking at starting with posterior innominate rotation mobility. And for this, we're just assessing how well the innominate can posteriorly rotate and looking for any sort of symptom response. So Josh, for this video, we're gonna be testing how well your pelvis can move kind of on each other since it has two halves. So we're just gonna be looking at this right half right now. And we're gonna test how well it can posteriorly rotate. So what you should feel is just maybe some pulling in some of the muscles that are connected to the hip. If you feel any sort of symptom response, just let me know and we can stop and I can kind of back off a little bit. But as far as this test goes, we're just going to be looking at the relationship between any pain, range, or resistance, and then, like I said, any symptom reproduction. So we're going to start bringing him into neutral spine. His hip's going to be at 45 degrees. And then his knees are going to be at about 90 degrees. And then I'll place my knee up on the table here, or sorry, before that, I'm going to bring his leg up into hip flexion here. And we're going to try to find his end range. When he runs out of hip flexion, his pelvis starts to move. It's right about there. So then we'll back off just a little bit. I'll rest it on inside my hip here. I'm gonna come around with my hand and block the PSIS and then just drape my elbow across the backside. With my other hand, I'm gonna come in, place it on the ASIS, and with this backhand, I'm gonna pull down and try to bring it forward, and with the other hand, I'm gonna push up and try to push it backward a little bit. And then with the leg, I'm just gonna wiggle my butt to get to move. And for this, we're going to be looking for R1 and then R2. So the first R1 is that first little bit of resistance, and then R2 is when we feel like he's going to run out of room and start to move through the back. One a couple times. There we go. And then Josh, I'll have you flip around, face the other way. And now we're gonna do anterior innominate rotation. So for this one, same thing, trying to get the back into neutral here. The hip's gonna be at 45 degrees and then knees are gonna be at 90. And we're gonna begin by bringing his top leg back and seeing how much hip extension he has before his pelvis starts to move. Right about there. And then we'll bring that leg up and we're gonna rest his lower leg on my knee this time. And that way we can kind of shift the hip and get that guy moving. And this time with the top hand, we're gonna come in, place it on the ASIS, and my elbow's gonna drape across the front of his thigh here. My other hand's gonna come on the back, resting on the PSIS. And then we're gonna all move together. This one's gonna pull down and pull back. This other hand's gonna push forward and then try to push it up. Trying to get some rotation. Looking again for the R1, the beginning of resistance, and then looking for the end of resistance, R2, and then assessing the relationship between any pain, range, or resistance, and then any sort of symptom reproduction. And that's it for anterior and posterior innominate rotation mobility. So for this next group of tests, this is going to be the SI joint cluster. So for these group of tests, it's going to be a clinical prediction rule where if you have 3 or more positives on them, it indicates that you have an SI joint dysfunction. And these 5 tests are very useful because you can use them on people with and without the condition because they have high sensitivity and specificity. And the likelihood ratios are fairly moderate to good as well. And then these can also be used in conjunction with the lumbar active range of motion testing, because if you get negatives on the lumbar active range of motion testing, but positives on these, then it indicates a SI joint dysfunction. So the first one we're going to start off with is the Gainsland's test. So Josh, for this test, I'm going to be testing your SI joint, for any SI joint dysfunction, what I'm going to do is bring one leg into extension, one into flexion, kind of separate them and see how well your pelvis tolerates, or your SI joint tolerates that. You might feel some discomfort, and then you might also feel some reproduction of your symptoms. Let me know if you do, and then we can stop. So I'll have you face me over here, sitting on the edge of the table, and then I'm going to help you lie back. And then with one leg, pressing it, bringing it up towards the chest into flexion, the other one bringing the knee down into extension, applying overpressure, any reproduction of symptoms, and then we'll reverse and then do the opposite, pressing and pushing. Good. And then I'll have you slide all the way back onto the table there. So for the next test, we're going to be doing the distraction. So for this test, you're going to need to get up higher than the patient so you can apply the downward pressure onto their ASIS in an attempt to push them apart. So you're going to place one hand on one ASIS with a nice broad touch. Sorry, we'll go like that. And then the other one on the other. And you're going to ease into the pressure, coming right up over top of them, keeping the arms nice and stiff. And then just trying to push apart. And for this, you would hold it for 30 seconds, looking for any reproduction of symptoms. And if they have some discomfort where you're pushing on the pelvis, you can put some pads or some towels just so they can make it through the full test. And then the next one we would do in the progression here for the clinical prediction rule is the thigh thrust test. And for this one, I'm gonna bring his contralateral leg up into 90 degrees of hip flexion, and then with this hand I'm going to rotate him over, put this underneath onto his sacrum, try not to block the ilium at all, and then with the other knee here tucked up into my armpit, I'm going to apply a force down, trying to shear the ilium on the sacrum, looking for any symptom response, and the patient should just feel possibly a little bit of discomfort. And we would hold this for 30 seconds as well. And then the next test is going to be the compression test. So Josh, I'll have you roll away from me onto your side. And for this one, I'd have them neutral spine, hip in 45 degrees of flexion, knees in 90 degrees of flexion. And then getting up on top of them again, and you're going to apply pressure downward onto the anterior lateral portion of the ilium. So one hand placed there, the other one on top, and the hand will wrap around to the ASIS. And with this one again, you're going to want to come up over top of them, applying that downward pressure, looking for any sort of symptom response. And the patient might feel a little bit of discomfort, holding this for 30 seconds. Good. And then the very last one, I'm going to have you lie prone, Josh. So I'm going to take this pillow away. And this final one will be our sacral thrust. So for this test, just to warn you, Josh, I'm going to be applying a very rapid force here, kind of like applying CPR. Just to warn you so you don't get freaked out. So for this test, I'm going to place one hand finding the end of the sacrum here and just laying it on top. Other hand's going to come up on top. Coming up again. Nice stiff arms, and then quick thrust, quick thrust, quick thrust. 2, 4, 5, 6. And so doing that 6 times. And they might feel some discomfort, and if they feel any sort of symptom response, then that would indicate a SI joint dysfunction. And like I said, if we have a positive test on 3 or more of these, that would indicate a SI joint dysfunction. Otherwise, they would be cleared of that. And that's it for the SI joint cluster.